I'd like to introduce Meaghan Delaney. Meaghan is a speech pathologist living and working in Kamloops, BC. She graduated with her master's from the UBC School of Audiology and Speech Sciences in 2014 and has been dedicated to adults with communication and swallowing disorders ever since. She first began working with people with Parkinson's in a multidisciplinary clinic in Surrey, BC, and was inspired by their resilience and determination. Since moving to a smaller community, Meaghan has been doing her part to increase awareness and access to services for people with movement disorders. I'd like to pass that over to Meaghan Delaney now. Meaghan, welcome, and thank you for taking the time to speak for us today.
Yeah, thank you for that lovely introduction, Alana, and thank you guys so much for taking time out to listen in. I'll let you guys know this is my very first webinar, so if there are any bumps, I apologize in advance. If you can't hear me, if you want me to slow down, say something again, please type it in the chat box. I love feedback, and I will do my best to modify that. So I just wanted to draw a little attention to the icon at the beginning. I love the talk about it because I think it reminds people that while my title says speech language pathologist, we also deal a lot with swallowing, and you'll hear the term dysphagia, so fancy term disordered problem, phagia meaning swallowing, and that whole mechanism of the head, the neck, your brain motor patterns, the brain stem where reflexes and those automatic movements are generated. That's something that myself and my colleagues spend a lot of time learning about in school, and really gives us a unique perspective on the overlap between speech, voice, swallowing. So I will click ahead here to my first slide. So this is just me at our World Parkinson's Congress in Japan last year. We're always trying to advance our practice and learn more about the state of the art. And I'm hoping to share a bit of that with you today. So I want to just go through some disclosures. So I am the owner-operator of Redwood Speech Therapy. I'm a certified provider of the Lee Silverman Voice Therapy, LSVT, and Speak Out Voice Therapies. I am not receiving any compensation from either of these organizations, and I'm not directly affiliated. I am a paid contractor for the Get Loud, Stay Loud forum. Okay, so those are my disclosures today. So this is our roadmap. I would love to go through the basics. What is Parkinson's in a nutshell? What do we hear in the clinic from our clients who have Parkinson's and their spouses and family? How does Parkinson's affect the voice and swallowing? What works? That's probably the biggest question, right? What works? What makes a difference? And we're definitely going to spend time on that. There's a couple things about where are we headed? What's the future state look like for therapy and treatment? And then we're going to do a few things now. So we're going to do a voice practice together, and I'm going to talk a little about some things you can start asking for from your physician, nurse practitioner, neurologist, speech pathologist, some real good questions to go to them with, and then we'll have more time for questions at the end. As you type questions into the chat box, I will do my best to answer them in the flow of the talk. If there's something I know that's going to come up later, I might leave it where it is and bring it up again. So I'll do my best to keep up with your ravenous questions. All right, so what is Parkinson's? In the simplest of terms, Parkinson's disease is when certain nerve cells or neurons within your brain start to break down, and specifically the cells that produce the chemical messenger dopamine. And in very, very simple terms, I'm not a neurologist, but as dopamine levels decrease, it causes those abnormal brain signals and brain activity, and those lead to the symptoms of Parkinson's. So the tremor that some people experience, rigidity, decreased voice volume, difficulty swallowing, the non-motor symptoms like anxiety, depression, disordered sleep, those kinds of things, all have to do with this decrease in dopamine. So in the clinic, this decreased dopamine, what we start to hear is, my wife needs hearing aids. People are always asking me, what? She sounds so much quieter than she used to. People start talking over me. Sometimes I just give up. I've had clients tell me, sometimes I just stop talking. No one's listening, or they're interrupting me. And I hear this a lot from partners. He thinks he's talking loud enough. He doesn't listen. I don't get it. He doesn't, he's not loud. And I keep asking, but he just doesn't. And we're going to get into the why, but I hear a lot of frustration from both the person with Parkinson's and their care partner or their spouse about this communication breakdown. I'm sure you guys might empathize or connect with some of these statements. And as you hear them, if you're like, okay, that is me, let's start to think about how we might address it, okay, and what you're kind of ready for in terms of treatment and assessment. So when we think about swallowing, what I hear is, she's always coughing at dinner. It takes me so long to eat. Everyone's done and I'm still going. Things get stuck in my throat. And I see a lot of, it's here, I can feel it. In later Parkinson's, I will sometimes hear, I worry about him choking. It's so hard to take my pills, and you're having to take these pills every day, multiple times a day, and it would just be so nice for it to be easy. And I don't like going out for dinner. It's too loud, so the voice part there, and I'm always coughing, right? It's uncomfortable. But why? Why is it changing your speech? Why is it changing your swallowing? So like I said, it's because of that decrease in dopamine. It's changing your brain's ability to send signals to your body. So in your mind, and as you're putting out that direction, like, hey, talk, that motor signal that used to be very smooth and full of dopamine and responsive is a little lagging. It's like a bad internet connection, only some of it's getting through. And the other piece with Parkinson's is that difficult time self-monitoring. Kind of in the clinic, I'll talk about it like a broken thermostat. The thermostat says the room is hot enough, but you know darn well that everyone's wearing a sweater and trying to layer up because it's too cold and that furnace isn't kicking in. And that's kind of what's happening with your voice in particular. Swallowing's a slightly different route, but we're going to talk a little about that. So this is my analogy. In very simple terms, two main motor pathways in your brain. I'm going to use the arrow here. So I think I am anyway. Okay, well, on the left of your screen, we've got the extrapyramidal system, the city streets. There's a lot of connections. They're the first roads you get on, that you go to them automatically, right? And you can probably use those city streets without thinking, right? You ever arrive somewhere and you're like, how did I get here, right? That's the automatic pathway. That's the extrapyramidal system. And then we have the pyramidal system. And I like to think of that as the freeway. It's direct. You do not make extra stops. You go from point A to point B and you're whipping along. You have to choose to get on it. You have to merely make the intention of getting on the freeway. It's rare that you end up there by accident. And once you're on the freeway, you have to focus, right? Every second, you have to be like, I'm in the lanes, I'm going this way, I'm aware of the car beside me. There's just some extra steps. And why this matters is because the extrapyramidal system relies very heavily on dopamine. Okay, so that automatic pathway, the thing that you go to first, those city streets, relies on dopamine, and you have less. And because there's less dopamine, when it goes through that system, you're getting that quieter voice. It relates to your movement and your walking, that change from a full gait to the little tiny steps. And what we do in therapy is switch to that pyramidal system, the highway. It's intentional. We have to think about getting on it, but it relies less on dopamine. And that's why there's a difference between your conversational speech you're not thinking about and the speech in the clinic when your therapist is telling you be loud, okay, because you're intentional. I'm going a little quickly through the nitty gritty. But what I want to talk about is treatment approaches, and I want to make sure there's time at the end for practice and questions. Okay, so in my experience and in the literature, so in journal articles, effective speech and voice therapy for Parkinson's is intensive. Okay, in order to change the way you speak in conversation, we have to lay down new pathways, new habits for speaking, and that takes diligence and time. Okay, in my experience when I was first starting, I thought home programs. People aren't able to come into the clinic. I'm going to give them a home program. Well, that works okay. It gets people thinking about their voice, but in the end, it's always, I'm not as loud on my own as I am with you, or he does it, but it's not the same, or she just doesn't do it. And apathy and that motivation is hard with Parkinson's. So it's not the person, it's the disease process. So for that diligence and that time, it needs to be intense and it needs to happen frequently. And you need to be able to have feedback. So, right, that thermostat is broken. I have to be the one telling you, or your speech therapist is the one telling you, hey, that wasn't loud enough. I need you to push more. I want you to do like me. Be loud, be clear, speak with intent. These are all cues that you'll hear. And your therapist is going to be the feedback loop to start. We're going to be the ones listening and telling you, hey, be louder, be louder, be louder. And over the course of your therapy, the idea is that you learn to self-monitor, okay, and that you start to become more and more aware of your voice and more in tune with what's your good voice and what's quiet. And the last thing, that effective therapy needs to be rewarding. Because you have less dopamine, dopamine is one of the reward chemicals in your brain. It's one of the things that make activities kind of pleasurable. You do it and you get an internal reward of this neurochemical. With less dopamine, there's less internal reward. So sometimes in therapy, I'm the carrot and the stick. I'm helping people get motivated and having an external reward. So if it's a checklist, some people really like to see that they've completed therapy 5 times or 4 times that week. For some people, it's a recording of themselves before and after or during and saying, oh yeah, I hear that. I sound better. I'm doing good. And just having that person on the other side, being your cheerleader, being your external motivation and your external reward helps with therapy. It's again why when I first started and I was doing these home programs and wondering, why isn't it working? And really realizing it's not the person with Parkinson's so much as it's me and my approach and how do I meet people where they're at? Okay. I'm going to take a quick pause because I've got time. We're doing good. Are there questions right now about dopamine and speech, about your experiences, about, yeah, just anything. Just want to leave a second and get a sip of water while I wait. So I see Brenda says I sound the same. So you feel like your voice sounds the same as it did before. That's a very common thing, Brenda. I usually hear it from spouses before the person with Parkinson's. How does one get to see a voice therapist? Yes, these are awesome questions. Yes, you can ask. Okay, we're going to talk about how to find a speech therapist, definitely. And I've got a slide. Jan, the webinar is being made available post. I don't know if it's just the slides or um, like the whole webinar. Is it more effective when the meds are on? I mean, yeah. So Irene, the things that help with more effective with the meds, giving more feedback. Yes, yes, Scott, definitely giving feedback. Respectful feedback. Okay, it's not you're too quiet, right? It's I see you're trying, but it's still a bit quiet, or we need more effort if you're a therapist. Um, Irene, in most people's experience with Parkinson's, the levodopa carbidopa doesn't affect voice and speech. Some people it does, and so it's not everyone, but for the vast majority, just medication isn't enough to overcome that quietness. I like working with people in both states because I like showing you that you are capable of getting louder in both. They might look a little different, and there might be other symptoms going on that make it hard to be loud. So there's always a bit of give and take. Um, if a person's really motivated, can they do it at home more? Yeah, I think home programs are effective for some people more than others. I think as long as you're getting feedback and you're really practicing consistently, it is helpful. I think someone needs to monitor your progress though, because we know that thermostat's not 100%. Perfect, Marcia. Does it have to be alone or can it be within a group? That's an awesome question. So in my experience, groups are excellent for maintenance and they are excellent for mild problems. And the reason that's been my experience is that because the person with Parkinson's needs so much individual feedback, that's hard to do as a group. In the early phases, it's good. And for maintenance, it's awesome because you have that community there and everyone's working in that same place and it's about maintaining and being loud together. Um, Lynn notices her speech is quieter. Yeah, I'm really glad that you guys are all here. I'm really impressed with the turnout today. There's about 55 people online and this is for you. So I see one person is typing. I'll wait till you're done and then we'll keep going with some of our slides and we'll talk about treatment. I'm going to give you guys time to get ready. I'm going to keep drinking water. Okay, so we'll wait for that one last question and then we'll keep going and talking about treatment. Okay, all right, so I think that's maybe everything. I'll get to you if your question pops up while I'm talking. Don't worry, I'll get to it. I want to make sure I answer everyone's questions as we go. So, current therapies for Parkinson's voice. I want to start with that. Now, we focus on voice because often if we treat the voice issue, we also get benefits in the speech. So what we see for people with Parkinson's is lower volume of their voice, sometimes a hoarseness, so there's a rough quality, less changes in your pitch, so very monotone and it's hard to know when you're happy and it's hard to know when you're sad, and people might always ask you like, are you okay? What's wrong? You're like, nothing's wrong, I'm fine. And then when you add to that masked facial expression, you start to look a little more serious than maybe you meant. So we focus on voice because we often get the other stuff for free, and who doesn't want, you know, one stone, two birds, right? So one of the most prominent therapies is Lee Silverman voice therapy, or you'll hear it called LSVT, loud. There's also an LSVT big, and that focuses on movements and walking and all that. So LSVT is one of our older therapies. It is tried and true. They've done a lot of studies on it with, random control trials and sham treatment. All that to say that it's a fairly high bar of evidence. It always, if you're doing LSVT, it's a registered trademark, and this therapy is very specific. It involves 16 therapy sessions that are an hour each over the course of 4 weeks, or ish. Sometimes there's an allowance for sick days. And it targets the use of a loud, good quality voice through a specific set of daily exercise and therapy techniques with a certified provider. Okay, and when you have your certified provider, they are meant to recertify every couple of years. They've gone through a very specific set of training, and there are rules for how you deliver therapy. In their studies, they've seen evidence of maintenance even 6 months post-treatment, which is fantastic. When we think of Parkinson's as being, it's degenerative, it does continue to change over time, and everyone changes differently. To have a therapy where you are still in the same place 6 months later, that is huge. One of the key things for LSVT is ongoing maintenance. So even when you finish with your therapist, continuing to do your daily homework and maintenance exercises. And I see from Richard that he attended the program and he had great results, but he's feeling there's a pre-LSVT volume in spite of practically daily therapy. Okay, so if that's starting to happen, it's an excellent time to get back to your therapist, because you might need a little tune-up, and you might not need the full 16 sessions again, but a few to like rev your engine and maintain. You might also look and see, Richard, if there are groups nearby where you can do maintenance. Because that thermostat isn't 100%, I do wonder if the effort you're using in home practice is the same as with your therapist. And it might very well be, I don't know, but it's questions, it's things to think about. So LSVT, I'll show you kind of where you can look for those certified therapists. But it's a good standard treatment. Feedback from clients, it can be seen as a bit boring or a bit repetitive. And that's always hard. We try to make it as fun as possible and as engaging as possible. But sometimes it's hard to help the medicine go down. So something that's a little bit newer, the same idea, focusing on the voice first, is called Speak Out. And this was developed by the Parkinson's Voice Project. They're a nonprofit organization down in Texas. And their focus is on speaking with intent. So there's that purposeful pathway, right? That intentional pathway, the pyramidal system, so you're not relying as much on dopamine. So it's also intensive. It's about 45-minute sessions, 3 times per week for 4 weeks. They're also provided by certified clinicians. So in order to do the Speak Out therapy, you've done the training. And it's meant to be followed by group maintenance in something called the Loud Crowd, which is quite fun. I love that name. But again, it's a group maintenance program, and ideally it's weekly. It depends on your therapist's availability, the setup of the clinic, a lot of system things that I wish I could wave a wand and fix. It's relatively newer in terms of evidence, but it's also showing really good results, really good maintenance. There's a cognitive component to it. So you're always doing like a cognitive challenge as a part of the therapy. And I love that because word finding and slower thinking is also an issue with Parkinson's, and that can keep people from talking. And the more challenging we make it, the more likely it is that you're going to carry it over from the clinic room to conversation. Spouses are definitely encouraged to attend any kind of therapy session. If your person with Parkinson's wants their care partner, family member, spouse, friend, neighbor, whoever, to be there to hear what's being worked on and how, absolutely. That's my preference. Maybe some clinics at the moment, because of COVID, if it's in person, are limiting the number of participants. But support is excellent. And seeing your partner or your friend make that progress, I think is really rewarding for you as well. So yeah, I really enjoy the speak out therapy as a kind of new, it's still 20 years old, but it's a new way of doing things. And I'm hoping that more and more people will get certified and that more and more people will be able to offer this. Um, so one option for maintenance, so let's say you've gone through your therapy and you're doing your daily maintenance, or maybe you're not quite doing it daily, and you need that motivation or that place to go to commit to practice. An option is the Get Loud, Stay Loud forum. So daily there are live streams of practice for both Speak Out and LSVT, as well as some expression practice and facial expressions and music and rhythm. They've got slides and things on swallowing and resources. It's meant to be maintenance. Some people come because they haven't had therapy yet and they just want to see what it's about, and that's completely fine. But we're always encouraging people to seek that voice and speech therapy first, so that you've got that base to come from and it's a place to practice. Okay, I'm going to switch gears to swallowing, and we're going to save some questions for the end, but I see more people typing. Don't worry, I will answer them all. Um, so I'm gonna switch those gears. So what about swallowing? So in my experience, swallowing, dysphagia, and Parkinson's, kind of a different beast. The amount of research is relatively small. Many of the exercises we're currently recommending are based on what we know about swallowing impairments and stroke recovery, which is a different mechanism. And it's not to say that it's wrong or doesn't work, it's just a different source. And it means that if anyone out there is looking to do a PhD, this would be really valuable. Sometimes I think I should go back and answer these questions, but what is it about Parkinson's that causes swallowing? How early can we see changes? What exercises are going to keep people on the right track? The reason we worry about swallowing with Parkinson's is pneumonia. That's really one of the big ones. For some people, when you're having difficulty swallowing, it means that some of your saliva, some of the food, some of your water or liquid is actually going down in your airway. And if small amounts of that continue to go down, takes bacteria from your mouth into the lungs and can cause pneumonia. And you might have heard the term aspiration pneumonia. That's a real scary word in the world of Parkinson's. And so that's why we're always watching. So if you or your family member are noticing, hey, they're coughing more at meals, or oh, you know what, you've had pneumonia 3 times this year. That's really unusual. Or that voice sounds wet or gurgly if there's after every swallow. Those are like the flags. Hey, we should be asking for a referral for a swallowing assessment. And I'll talk about how you access those as well. So much ground to cover when it's swallowing and speech. I could talk for an hour about both. So in the meantime, while we're still answering those questions and we're trying to figure out what exercises work and why and how do we do them, there's one that I found to be quite effective. There's a good small amount of research called expiratory muscle strength training. So it's a device, it's the EMST. So what you're doing is breathing out against resistance. So there's a little device and you do, and patients like it because of the protocol. It's really easy to follow. It's really, really simple. And what we see at the end of it is improvement in cough strength which I know for a lot of people with Parkinson's that can decrease. Watching people cough and then go is kind of like, whoo, I want to just like give you a squeeze and have a good strong cough come out. And the other part it improves is hyolaryngeal excursion. Basically, it's the muscles that lift, sort of where the Adam's apple would be, a little notch there, and the muscles that lift that, and that lift action is really critical to the closure of your airway when you swallow, so protecting it. And it's also it's critical to the epiglottis. It's a little kind of flap of cartilage in your throat that helps protect your airway. In people with Parkinson's with the weakness, it doesn't go quite all the way, and people tend to get some residue. So it kind of like sits in this little pocket cavity, and people are like swallowing and swallowing and swallowing, trying to get it down. So improvements in those things are really meaningful for swallowing. And like I said, in my experience, clients really appreciate how simple it is. So caveats, I just want to say before you all run out and try and buy an EMST, treatment should always be monitored by a clinician. And there are some contraindications to using the device. So because you're generating a lot of pressure, not a crazy amount, but enough, if you have worries about really high blood pressure or aneurysms, different kind of cardiac things, it can be a no-no. So it's a good thing to bring up with your speech pathologist. It's a good thing to bring up with your physician and say, hey, I'm thinking about doing this thing. Can you look and tell me if it's safe for me? It's nice because you can use it for maintenance and you can use it to keep practicing even when the majority of your therapy is concluded. This is an interesting one. It's sort of the future of swallowing therapy. It's called VAST, Video Assisted Swallowing Training. Essentially, your therapist completes a video nasal endoscopy. So some of you might have had this test at the hospital with your speech pathologist or seen an ear, nose, and throat doctor. And basically, they pass a flexible camera through your nose, down the back of your throat, and they look right in your throat as you're swallowing. And what that allows for is biofeedback. So we can show video to you as you're swallowing. You can see what's happening in here, and we provide training around that and giving you feedback on, see how there's, this is happening, I want you to do this to make it better. It's really fascinating to me that this worked, and it worked after about 6 sessions, which really isn't much time. But my shower thought, so that thought that you have while you're washing your hair and you're mulling it over is the training watching the videos, or have we taken the automatic, the swallow, and made it purposeful? And that's why we're seeing improvement. And I think that really speaks to, again, that change in the pathway from automatic, the city streets, the ones you know really well, you do it without thinking, and we call it volitional, but that intentional pathway of I'm eating, I'm chewing, I'm swallowing, and just really thinking about it as you go. That's my thought. They'll need to do more research to know why it works and the mechanisms, but I think it's really interesting that we're going that way. So yeah, again, my personal thoughts, and these are born out of, my experience and interactions with clients and interactions at education events, is that, in my opinion, knowing what we do about physical function and Parkinson's and the role of exercise in the management of that, I think there's almost always room for therapy in swallowing dysfunction in the mild to moderate stages. So sometimes when people are quite advanced and there's lots going on, we're not maybe using a therapy approach. We're not trying to change the muscles or the system. Then we're going to use strategies, okay? Or we'll play around with the texture of food, or we'll play around with supports and systems. But I think in the early phases, we should be really pushing for therapy and therapy plans and testing. And my hope is that with some new research, we'll have new and effective therapies for people with Parkinson's that isn't tough to swallow. And I say that because sometimes it's boring and it's tedious. And I wish we'd have something that I can point to and say, this works. But I do know that our exercises from stroke are effective, and that we should be supporting clients to participate in those type of therapies. It's my belief that we shouldn't be doing a modified barium swallows, that video swallowing test, and then saying this is it, and you just do these kind of swallow or this kind of diet and you're done. No, we need to improve it. People with Parkinson's do well with exercise. We know exercise works. Like, please, 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 please ask for exercises, and ask your speech therapist. If they're deciding not to, ask why, because they might have a very sound rationale, and I don't want to impede on anybody's practice, but they might have something that is very unique to you and why it's not indicated. But I think ask for it and they will give it. Okay, so I want to give you guys some strategies for your meals, and for pills, because I think practical, practical, practical. So number one is sitting upright. Yeah, I've had people who like to lean all the way back, or eat in a recliner. It's a little more difficult. Gravity's doing some work there to move things back far or faster. So you're going to be upright for your meals. And this is the intentional part. Do one thing at a time. We know that multitasking is not easy with Parkinson's. Okay, again, it has to do with that motor pathway and that automatic. So people joke about walking and chewing gum, and it's like, no, or walking and talking, and no, probably you can do one of those things well at the same, one at a time. Um, and so if that means you're going to like a social event and you're like, you know what, people are going to be eating, but that makes me cough if I talk and eat, have a snack before you go. Just graze when you're there, or kind of prep yourself so that you're not having to try and do these two things at once. Some people find that drinking from a shorter glass is easier. So if we can keep our chin relatively parallel to the floor, it's going to make swallowing easier than if we're lifting our chin. So short glasses, or water bottles that have a straw down inside. So again, you can just keep your head level. If pills get lost in your mouth, okay, because you're having trouble moving the food around with your tongue, and maybe you have a tremor, maybe it's just not coordinated, you could try taking them with a little teaspoon of applesauce. And the applesauce just kind of coats the pill and lubricates it and helps it go. The other thing people can do is sip of water, tilt to the very back of your tongue, another sip of water. I tend to do that with one pill at a time, not handfuls. And the last thing I have here is oral care, oral care, oral care. So I mentioned before that the real worry and the real like scary thing that can happen is aspiration pneumonia. And that really is related to bacteria from your mouth getting to the lungs. And if we can reduce the bacteria here, that is a big deal. I meet people with dentures all the time and I ask, when do you brush your teeth? They say, I don't brush my teeth. Oh. Brushing your tongue, your gums, your cheeks, even if you have dentures, really important with a nice soft toothbrush. If you have dentures, taking them out and soaking them overnight, giving them a clean. If you have natural teeth, brushing with a soft toothbrush and toothpaste morning, evening, that's excellent. If you can add flossing, your dental hygienist will love you even more. But oral care, oral care, oral care. Okay. Before I get to, we're going to do a little practice today, and there are just a few things that I think are very helpful for your voice and for keeping you going. And it's just some activities you can do on your own while you're getting ready to meet your speech therapist. So I also see, Ben, that you had your full course of LSVT before with success, but it's hard to maintain. And now you feel also back to the state before LSVT. Yeah, and I think that really speaks to the progressive nature of Parkinson's. And I think what it speaks to is that need for intervention early. And then as there are changes, little maintenance sessions, okay, to kind of get you back up. And it might not be that we get you 100% back to that right after your LSVT or speak out. But if we can get you close, I should say actually with evidence, there's some evidence that that intensive voice and speech therapy actually helps with the oral phase of swallowing. So the chewing, moving food in your mouth, saliva management. So if you get a bit of like drooling, it can be helpful for that. And it can also help with facial expression. So having more movement and expression and motion visible on your face. There's connections there as well. So we are going to do a few things. Dry mouth. Yeah. Actually, I thought I put that in one of my slides, but maybe I didn't. There's two things. Sipping water is pretty good for dry mouth. The second thing, and the thing I love, and I actually give them as samples to almost all of my Parkinson's patients, are these things called xylamelts. And what they are is a little pastille. And you don't kind of suck on it. It actually sticks to your tooth or your gum at the back, at the bottom, or the top. And as it dissolves, it releases something called xylitol. It's a sugar alcohol, and it makes you salivate. And it works really well, and they're approved for overnight use. So you can go to sleep with one or two in, and it helps with that dry mouth that kind of builds overnight. Xylitol can have a bit of a laxative effect, which usually for my patients with Parkinson's, I hear, oh, thank you. So what we tell people is to start slowly. So start with one or two, see how your body reacts, and then go from there. They're available at Shoppers, London Drugs. I'll thank you, Amy. Yeah, xylamelts, and the ingredient is xylitol, which is present in actually a lot of sugar-free gums now in about the same amount. So you can always, if you're a chewer, you could use some gum as well. All right. Any other kind of questions about the swallowing piece, and then I can get you guys going on some exercises here. The other thing too with the dry mouth, the dry mouth for the meds, water or non-caffeinated, non-alcoholic beverage. So herbal tea is a good one. Some people like having a nice herbal tea, water, fizzy water sometimes. Juices, anything without caffeine is good for moisture and good for your voice. Okay, let Krista keep typing, and then we'll go on to our exercises because we've got about 15 minutes, which is perfect. This is swimming, going along swimmingly. Oh, that's really cool. Okay, so we're talking about the improv sessions through the Parkinson Society and helpful for speech and understanding why I often can understand is fun. That's awesome. I mean, rewarding, right? There's feedback there, there's motivation, there's enjoyment, and life is about more than therapy. So I'm really glad that you guys are enjoying that, Krista. And you know what I wonder? What I wonder about that is improv intentional, right? Because you're really having to think about it, and you're also pretending. You're imitating, and I think imitation is a very intentional thing, right? It's like if you're not faking an accent, but like putting on an accent or putting on a personality, that's intentional. And I wonder if that is why your voice is doing that thing. I think that's really cool, Krista. Yeah, good on Parkinson Society. That's such a cool activity, the improv. Yeah. So what we're going to start on now is some exercises that I think everyone should do with Parkinson's, my opinion. So let's get started. The first one is deep breathing. And the reason I include this is that there's a nice little study where they had people with Parkinson's do 15 deep breaths each day for about 8 weeks. And at the end of it, people reported less fatigue and they actually had a measurable change in their lung capacity. And lung capacity and energy and like that all fits, right? Having enough breath to support a voice, to support a cough. So let's do that together. So I'm going to adjust here and we're going to do 3. And what we're going to really focus on is we're going to breathe through kind of like we're using a straw. And we're going to think about breathing into our bellies or your diaphragm. Okay, so we're going to do 3. Ready? We're going to do our first one. We're going to do We're going to do another one really deeply in. See if you can fill your lungs as wide as they go. I'm just actually taking normal breaths. Out. Okay, we're going to do another deep breath in. And out, nice and slow. Nice. And we're doing it with control. Okay, and you're thinking about breathing, you could think about breathing into your chest, you could think about breathing into your back, breathing into your belly, just really taking some nice breaths. This is something you could add to your wake up routine. You know, you open your eyes, you kind of move your body, and maybe as you're lying down, you start your day with just 3, 5 nice, big, relaxing breaths. Okay, like I said, this helpful with lung capacity, helpful with reports of fatigue, and who doesn't want to feel just a little more awake? Okay, so hopefully that's helping you feel relaxed. Now that you've got some breath, we're going to say ah. This is the bread and butter of almost every voice therapy program. And it's what we're going to be doing is using our ah with our loudest good quality voice. Okay, so what that means is I'm going to demo what not so good. Ah, okay, sounding like a teenage boy, not good. We want ah, so smooth and clear and loud. Your voice activities, as my caveat, should never hurt. Okay, it should never hurt your throat, never hurt your vocal cords. It should feel comfortable. Okay, and if it's not feeling comfortable, please stop. And you're probably one of those people that needs a speech therapist to help get you to that good place, because there's techniques we can use in person to get you to a good voice. So we're going to do 3 ahs, and we're going to hold them for about 5 seconds. We're going to just start in a comfortable note, and I'm going to count with my fingers, okay? So ready? We're all going to do like me. Ah. Beautiful. Was it loud? Was it clear? If you think, you know what, I could have done better, let's try the second one. Ready? And I'm going to do this one different. I'm going to start with a ha, okay? And you can join me. Ready? Ha. Hopefully we're ready for our choir soon. Some of us shouldn't quit our day jobs. Number 3. Ha. And if your neighbors can hear you, you're doing it right. I'm going to mention something actually. A lot of people, when we're doing this voice therapy and we're trying to get loud, they'll say, I'm shouting. I can't do that. I'm shouting. I promise 99.9% chance you're not. It feels like shouting because it's so much work. But all of your work right now just gets you from a whisper to normal. Okay? Everyone's a little different. I won't make generalities. Maybe not everyone. Some of you might be shouting. And that's why you're going to go see a speech therapist to tell you where you're at. But because you're putting in so much effort, your body is saying, I'm working as hard as I can. I must be shouting. And that's where the therapist comes in to give you feedback and say, that's actually normal. That's how much effort it'll take to get a normal, loud, clear voice. So it should feel like work. Okay, this is one of my favorites because it's nice and gentle on your voice. We're going to play around with pitch, but we're going to pretend to be some sirens. And so what we're doing is we're saying ooh, and we're going to go up and down in pitch. Okay, so it'll be like this. We'll do 3 together, but I'll do a demo. Ooh. Okay, so you can hear how it sounds like a siren. So all together, we're going to do 3. So we're going to start it at a high. Ooh. Good. Keeping it loud and clear. I'm going to do the second one. Ooh. Nice. Last one, loud and clear. Make the neighbor's dog bark. Ooh. Good. I don't know about you, but I feel a lot of vibration in my face when I do that, and that's my voice, my vocal cords vibrating and resonating through my whole head. So it'll feel a little funny, but that's kind of normal. And it's okay if your oohs are very like ooh, like not much difference. It's a place to start. You're going to work on pitch and being expressive. And that's everything. Wow, the timing worked out. Questions, comments, interpretive dances. I can't see you, but I can feel them. I will do my best to answer as many as I can in the next few minutes. Oh, there was one question about cost. So that depends on how you're accessing therapy. One of the things I really applaud Parkinson's Society for is their initiatives and their work in improving access to speech pathologists within the public system. And I'm really excited that there's a new position over in Victoria. So if you're in Victoria, lucky, there's a new speech therapist there working in the movement disorders clinic. And there's some access to, oh, in Kelowna as well. Kelowna's, I think, 1 day a week. And I mention that because it means that you're not going to be able to get some of the intensive programs publicly as easily. It really depends on the city you're in. It really depends on the service providers and their wait lists and everything else. So, okay, so if you're going public, it's free. You might have to pay for parking, but there are some publicly available speech therapy for LSVT and for Speak Out. If you are going private, that all depends on your therapist and the rates that they charge. And that's something to kind of ask them. The range generally $120 to $140 an hour. But everyone's different and they have different operating costs and different things. So that's a general guide. There's also an assessment in there. Someone asked about saliva. Good question. You said excess. Fun fact, because you're not doing a lot of those automatic things as well, swallowing is one of them. So that reflexive swallow of just swallowing your own spit happens less often with people with PD. And so saliva builds in the mouth, and either it comes out the front as drool or it goes down the back. And sometimes suddenly people are coughing. So for managing saliva, if it's just a little bit, sipping water is a great way to manage that, and just sipping every so often. And that anything you can do to make yourself swallow more frequently will help with saliva. The other thing is for some people chewing gum or sucking on a hard sugar-free candy, because it's that same thing. It just cues you to swallow more frequently. if it's very extreme, and you're really dealing with a lot of saliva, physicians will sometimes prescribe uh, atropine drops. It's actually an eye drop that they drop under the tongue and it'll dry out. Saliva is important to your mouth health, so anything we can do without drying you out completely is good. But I understand it's a hard thing it must be a hard thing to live with. You know, when we've had dental work and you're kind of drooling, it's uncomfortable. But if it's your daily life, anything we can do to reduce that and make you more comfortable. Speak out in Vancouver. Good question. So it depends if there is a Speak Out certified clinician in the Vancouver area, and I have links here for Speak Out. So there's a video on voice and the changes with Parkinson's, and on their website they have lists of certified providers, as well as on LSVT. I've got our link for the voice maintenance forum on Get Loud, and I have a link for finding a speech pathologist from Speech and Hearing BC. And so they're a provincial association, and they will have lists of private therapists in your area, and and depending on, they might have lists of what their certifications are. Can LSVT be done online? Yvonne, yes. Yes, yes, yes. I mean, that's the one great thing about voice therapy is that assessment and treatment can be done online very well, as long as you have a good internet connection and good audio. So that's one of the big things is the audio. Platforms can be a bit hit or miss, but it's great currently with COVID because we get a lot more flexibility and people are able to access therapy. And sometimes I don't seem to have enough strength. Any suggestions for strengthening voice in real time? Yeah, Lars. So, and that really speaks to that. I don't think I've actually talked about it, but the change in the system. So it's a cycle where you start using your voice and the muscles and your breathing less, so you lose a bit of capacity and sort of range of motion strength. And then you get quieter and then you use a little less, and then you get quieter and use a little less, and it can be a bit cyclic. Lars, in the moment, the best advice I can give is to be intentional and really work at the projection. Without hearing you, it's hard to know, you know, what you're getting for your effort. So if you're getting a decent voice with that work, that could be something to work with. If it's still quiet, there might be some other ways to work and kind of work at that capacity. It's okay to take breaks. It's okay to rest when you're tired. It's okay to take a pause, take a sip of water, recharge yourself, and then project. How important is it to get therapy early? Oh, it's a good question. I think that we get the most out of therapy when it's in that mild, moderate phase. So when it's enough to be noticeable, but not so much that it takes an 11 out of 10 effort to make it normal. And I think the earlier that you work on that, the better, in my experience, in my opinion, and access varies. I hope that answers it, Randy. I think it's important, and a lot of our evidence says, get in there early. We've got some more questions. How are you doing for time? I'm happy to answer questions for as long as people want, but Amy and Alana probably have places to be. I think I'm getting all these. Good. I'm glad you're getting a lot out of it, Anne. Like I said, I feel so lucky to be a part of this and a part of this community, and I see so much resilience and energy and drive, and I just want to match you. I just want to be where you're at and help you advocate for service. I'm gonna take a sip of water. Thank you, Barbara. Good. Thank you. I'm glad it was useful. From Cranbrook, wonderful. Nice to see someone else in the interior. Yeah, if so, looks like we're okay for staying a few more minutes if there are more questions. So I'm happy to sit here and do that. Um, Trying to think of any other things that kind of come to mind. Impact Parkinson's. Oh, yep, yep. You've got a voice therapy group online. Thanks, Sarah. Uh, links that show mechanics of a swallow. That's a really good idea, and I should have put that in here, John. Why don't I send a link to Amy and Alana, and we can put some stuff on there about that normal swallowing. Good. Ah, Barb, yes, I thought I recognized. Yeah, you're very welcome from Kamloops, hometown. Perfect. Any other questions, feelings people are having? Trail, welcome, Lynn. Good. Sounds like those are everything for people's questions. I'll put a link, like I said, I'll send a link to Amy and Alana about um, uh, normal swallow and what that looks like. Um, and uh, I might just also include an extra little slide about options for swallowing assessments. So what are you going to ask for? What's the process? Because I didn't really touch on that much today. A lot to talk about in an hour. Thank you guys so much. Have a wonderful day and stay loud.